Let's talk about how to approach a case of back pain in the MRCP PACES examination. In the long clinical consultation, you would have 5 minutes outside to prepare, 15 minutes inside with the patient or surrogate to take the history and examine the patient, and 5 minutes viva with the examiners. So while you're waiting outside, I'll tell you how to effectively prepare during those 5 minutes. You'll be given an information scenario about the presenting complaint, which is back pain in this case, the duration. Sometimes any associated symptom or vitals might be given as well. You'll be given a piece of paper and pencil that you'll be allowed to take inside with you. You do not have to write down any differentials outside unless it's hinted in the scenario. You can just write down the biodata so you don't forget the name. So, name and age of the patient, the presenting complaint and duration. If there are any abnormal vitals, write that down and write down what you'd like to examine or specifically ask during your history taking. So, in this case, you can write down type B symptoms, which means the constitutional symptoms, such as fever, lymphadenopathy, night sweats, and weight loss. Secondly, you'll write down and any red flags. So in this case, you can write down any incontinence, urinary or bowel incontinence, and saddle anesthesia. Because sometimes you forget to ask about this in the case of back pain, and these are very important questions. In the examination part, you can write down inspect the back because sometimes candidates in a rush forget to inspect or check for tenderness in the back. So that's very important. Write down inspection and palpation of the back. Secondly, write down lower limb examination. Neurological examination for the lower limb is mandatory in the case of back pain. If you don't have time, you can at least offer it to the examiner. Or if you start doing it, the examiner might stop you in between if it's not required. Or they can tell you the findings because it's there's not sufficient time to do a detailed lower limb examination unless it's the primary case. Okay, so when you go inside, you'll greet the examiners, greet the patient, and then start your history taking. What you see on the screen is just a broad classification of some important and common cases that appear in the exam. Vitamins is a mnemonic that can classify into different subsections: vascular causes or infectious causes, trauma related, inflammatory, malignancy. So, PAIR is a mnemonic for all the inflammatory causes of back pain, such as psoriasis, ankylosing spondylitis, IBD related arthritis, and reactive arthritis. Others are neurological or infectious causes, such as TB or discitis, and it can be uh, a malignancy or metastasis as well. So, we'll talk about how to effectively rule out each one of these while taking the history. This template is available on the Instagram Basis Guide page. You can take a screenshot as well. So the first 4 or 5 points are fixed in every case of LCC, so practice them well. Start with introducing yourself. Hello, my name is Dr. X. May I confirm I'm talking to Mr. or Mrs. XYZ, who's Z years of age? We are here to talk about your health condition. I would like to ask you some questions and then examine you afterwards. Would that be okay? Alright, so I've gathered from your notes that you've been having back pain. Can you tell me more about it? So at this point, the patient might offer you 1 or 2 sentences about the details of his back pain. So at that point, say, I'm sorry to hear that. I'll try my best to help you out today. So the first 5 or 6 points are fixed, and you can express empathy early on. The next step would be to explore the main symptom. Back pain is a pain complaint, so you can apply the mnemonic Socrates to it. So you'll start with, okay, can you tell me where exactly the pain is, or can you point it out? So this is the site. They might tell you it's in the upper back, middle back, lower back, or just point towards it. How did it begin? They'll tell you whether it was acute or chronic. Has it been, was it sudden in onset or gradual? If it's acute, I actually, regardless, just ask, do you remember getting an injury before it? Or do you remember living and lifting any heavy weights? Next step would be to classify the character. Can you describe the pain? If they don't offer anything, you can give them some leads. Is it sharp, dull, aching, or throbbing? Next step is to ask, does it go anywhere else? Maybe down your legs? This is for radiation. Do ask about the severity. So, on a scale of 1 to 10, with 10 being the most severe, how would you rate the pain? So, if it's anything above 5 or 6, say sorry. I'm sorry, that must be very distressing. Are you okay to continue now, or would you like some painkillers? So, the patient would always say that it's okay, we can continue. But don't just dismiss when the patient expresses that he's in severe pain. Acknowledge it. Okay, so you can ask. Now, at this point, you're going to differentiate whether the pain is mechanical or inflammatory. You can ask, okay, can you tell me what time is it worse? If it's worse in the mornings, it's likely inflammatory. If it's worse in the evenings, this is mechanical. So they can tell you the time. So what makes it better and what makes it worse? This is a classification. So once you've established the type of pain, which will be done early in the history taking part, if it's mechanical, you need to think about some causes such as fractures or degenerative disease, and you can differentiate between these both by the onset. Acute onset would be a fracture, whereas a chronic one would be osteoarthritis or degenerative disease. Also, all of this is more common in the older age group. So again, mechanical back pain would be worse in the evenings. It would become better with rest. On the contrary, inflammatory back pain, more common in younger people, would be worse in the mornings, and it will become better with exercise or with exertion or work. Also, ask about any associated symptoms. You can ask, do you have any stiffness with it? Inflammatory back pain would have morning stiffness with it. And like I said, the inflammatory causes are seronegative arthritides, which is PAIR, psoriatic arthritis, ankylosing spondylitis, reactive, and IBD associated arthritis. So if the pain doesn't fit into either of these criteria, you can ask some more leading questions. So if the patient mentions it radiates down the leg, you can ask, okay, do you have any numbness or tingling with it? And that can be seen in spinal stenosis or disc herniations. These are sciatica or radicular pains. The next step would be to ask those type B or red flag questions. You can ask, do you have any raised body temperatures? Have you experienced any night sweats? Any lumps or bumps on your body? Any changes in your weight? If the patient has lost weight, ask how many kilos over how long. And just to be sure, was it unintentional? And has there been any change in your appetite or your diet recently? So it's very important to ask these 3 to 4 questions every time you see a case of weight change. So it's intentional or not, the appetite, and change in diet. So besides this, you can ask those red flag questions. Have you? I'm sorry to ask you this question, but have you noticed any difficulty in controlling your waterworks or your bowel movements? Have you lost control of your waterworks or your bowel movements? About cellular anesthesia, you can again say sorry to ask you this question, but when you wipe your back passage, do you feel the sensations normally? So this can indicate saddle anesthesia, which would be seen in Corda-Equina syndrome. So if you have any red flag features, if it's anesthesia or bowel or bladder problems, think about cauda equina or any spinal compression. If there are any constitutional symptoms such as fever or weight loss, night sweats, think about infections. If it's especially if it's acute, or think about malignancy. Really uncommon causes would be cases of referred pain. These are not really common in the examination. Aortic aneurysm or pancreatitis or renal colic can be referred to the back and present as primarily as back pain. So again, the red flags: um, an older patient, more than 55 years of age, sudden onset with no trauma. If they already have cancer or they have family history of cancer, there's unexplained weight loss, fevers, incontinence, or maybe urinary retention, nocturnal pain, or if they're already immunocompromised, if they have diabetes, or cancer, or if they're on IV drug use. Okay, so back to the history. Now that you've explored the back pain in detail, if you see that if you think that the patient is pointing towards, let's say, inflammatory back pain, and you think it's ankylosing spondylitis, you see it's a young male patient with early morning stiffness and pain, you then need to ask very specific questions about ankylosing spondylitis. That would be, have you noticed any redness or pain in your eyes? This is to rule out anterior uveitis. Have you noticed any cough or breathlessness, to rule out apical fibrosis? Any chest pain or racing or pacing of your heart, just to see any cardiac abnormality such as aortic regurgitation? You can ask about any other joint pains. So whenever one joint is involved, ask about other joint pains as well. And also ask about, is this the first time you're experiencing anything like this? So we can know if the symptoms have been coming and going. Okay, so once you've thoroughly explored the main complaint, next step would be review of symptoms. So if you think the diagnosis is clear at this point, you can ask specific questions such as we just did in ankylosing spondylitis. If not, you can take a quick systemic review of other symptoms. You can say that I'm going to ask you a few questions and you can answer in a yes or no manner. So you've acknowledged that it will be a quick checklist screening, so they don't feel like it's a rapid fire, um, and you can just save your time. Then ask some questions starting from head, go from head to toe. Do you have any headaches? Any problem with your vision? Any dizziness? Any sores in your mouth? Any difficulty in swallowing? Any swelling on your neck? Any chest pain? Chest discomfort? Any breathlessness? Any racing or pacing of your heart? Any tummy pain? Feeling sick or throwing up? Any problem with your waterworks? Any loose stools or hard stools? Any numbness or tingling in any part of your body? And so on. You can also ask about, have you noticed any skin changes such as rashes? After this, you can ask, okay, do you have any other health conditions that I should be aware of? You can also ask this in the beginning and explore it later. Have you ever been hospitalized before? Have you had any surgeries before? Do you have any family history of any health condition? And then, before asking about smoking, say, I'm sorry to ask you this question, but do you smoke? Or have you ever smoked? If they say yes, you need to refer them to smoking cessation, regardless of the amount of cigarettes that they smoke. I'm sorry to tell you this, but smoking can be injurious to health, and I would like you to stop smoking. And if you need help with that, I can refer you to the smoking cessation services. Would that be okay? All right. Have you ever taken any recreational drugs? Do you drink alcohol? How much alcohol do you drink? So the weekly limit is 14 units a week for both males and females, and it should not exceed 2 units per day, because some patients might not drink the whole week and then binge on weekends. So if the patient is exceeding the limit, you need to remind them and ask them to cut down alcohol. There's no alcohol cessation, you need to cut down to the social limit. Okay, so the occupation is really important in the case of back pain. So may I know what you do for a living? If the patient has been in contact with animals, you can think about brucellosis as a possible cause of discitis. Or maybe it could be a possible cause of back pain if he's a laborer. Very important to ask about the impact this pain has on his life. So, may I ask, how is it affecting your job and your life? If the patient says, yes, it has been affecting my job, I am unable to go to work or I'm unable to help around the house, offer some empathy at this point, I'm very sorry. What we can do is involve an occupational therapist and he can help you out. And we'll try our best to offer you some medications to relieve your back pain till we get to a diagnosis. So, an occupational therapist can, this is something to be noted. An occupational therapist and occupational health worker are separate entities. Occupational therapist would help the patient to adjust and improve his quality of life and improve his daily activities, whereas an occupational health worker or an occupational health department is a department in the hospital in the workplace which can help their employees. So in this case, an occupational therapist would be helping him. Next step, driving. Do you drive? If the patient has maybe numbness or weakness in his legs, You need to ask him if he's having difficulty, and you need to ask him to stop driving temporarily till we get to the diagnosis. Otherwise, in other cases of back pain, it won't be necessary. Ask about his sexual history. I'm sorry to ask you this, but do you have any regular or casual long-term partners? If he does, ask if he practices safe sex. Do you use condoms or do you use protection during your intercourse? This is important for some cases such as reactive arthritis. Okay, if the patient is female, do ask about the P's, pregnancy, birth control pills, and periods. So, may I know if you have any children? Have you had any miscarriages before? Are you on any birth control pills? And then travel history. Have you traveled anywhere recently? And then if he has, ask the details. Where did you go? When did you travel? How long did you stay there? What activities were you involved in while you were there? Now, this is only important in a few cases, especially if it's related to constitutional symptoms, which can point towards an infectious cause. Okay, so when you're done taking the history, examine the patient starting with the inspection of the back. Look for any kyphosis, scoliosis, any scars, and then ask the patient for permission and then check for tenderness. Do a lower limb examination, or at least offer a neurological examination of the lower limb, and do the relevant examination of the differentials that you have narrowed it down to. So, this is how you approach a case of back pain. I will be covering seizures next, but if you have any other complaint or any other symptom that you're having difficulty with, please leave a comment, and I will leave a list of these questions on the Instagram page in the upcoming week. Thank you for listening.